Hi, my name's Travis Donahoe, and I'm an assistant professor and health economist at the University of Pittsburgh.
Hi, and I'm Paul Joudrey, an assistant professor at the University of Pittsburgh School of Medicine, and I'm a primary care physician and addiction medicine specialist. And we're going to be talking about our new research titled Restrictive State Opioid Treatment Program Policies Constrain Local Access to Methadone Maintenance Treatment. So, methadone maintenance treatment represents a large missed opportunity in our response to the ongoing overdose epidemic. Methadone maintenance treatment arguably may be the most effective treatment for opioid use disorder and may be particularly important in the setting of widespread fentanyl analog use. The vast majority of people with opioid use disorder in the United States do not access methadone maintenance treatment, and methadone maintenance treatment is uniquely heavily regulated. A lot of the previous research has focused on the effects of how federal regulations may constrain access to treatment. But state regulations also exist, and states can add on additional onerous regulations on top of the existing federal rules. And the effect of state regulations has been relatively less studied. And this can include limits on opening new clinics or onerous requirements on patients that put barriers to staying in care, such as limitations on how much medications can be taken home. And so we focused on how state regulations may impact access.
To study this question, we analyzed nationwide data on opioid treatment programs, as well as how much methadone they were distributed in 2019. And we matched that to a list of state rules that were like the ones that Paul just discussed. And we focused on state borders where policies changed from being more restrictive to less restrictive. And the reason that we focused on state borders is because people tend to generally be fairly similar to one another when they live in zip codes that are just on the opposite side of a state border from one another. But state policies change at these borders a lot. So by comparing how much methadone access changes across the state borders, we can see how big of a difference the policies make. And the difference is really big. We found that zip codes that were just inside the border of states with less restrictive policies had about double the number of opioid treatment programs and methadone supply. Overall, these findings show that state policies play an important role in shaping geographic access to methadone maintenance treatment in the U.S. And they show that easing the most restrictive policy can help more people get the treatment that they need locally. For more details, please check out our article in the September 2025 issue of Health Affairs.